So Dr. Matthew Lee is Sustainability Lead for Doctors Association UK. Thank you very much for joining us. We know there's been a huge strain on hospitals, obviously, with these various heat waves, this being the fifth or sixth, Dr. Lee, and clearly that presents a huge problem.
Yeah, thank you very much for having me on. The conditions that have been described within hospitals, people have used words like unbearable, inhumane, completely without dignity for patients. They've just been really, really horrific over these last 5 heat waves now, which is a record number of heat waves in the UK. Now, earlier in June, we did a survey of healthcare professionals across all healthcare professionals, and 96% of these healthcare professionals said that their workplace, i.e. their hospital or their GP surgery, was either uncomfortably warm, very hot, or dangerously hot. About 70% said that they felt that patient safety was directly affected, and about just under 90% said that they or their colleagues felt unwell because of the heat. And these conditions have been absolutely intolerable. Some of the sort of quotes that we've received from these healthcare professionals have been things like, to use the direct quotes, we've had patients brought in due to severe heat stroke who are not able to be treated properly because there is nowhere cool to put them down. I can no longer care for patients safely. Septic patients are left in corridors with ambient temperatures of 33 degrees. Nurses have collapsed. Patients are too hot to engage with occupational and physical therapy, and no progress is made towards discharge. And perhaps most concerningly within all of this with regards to hospital infrastructure, is that we had 5 reports, separate reports, of the heating still being on in these heat waves, which is just absolutely inhumane. It's horrific. That's
crazy. And the whole, I mean, it's not just noting the severity and seriousness of hospitals. It is not just the hospital setting where Britain is woefully equipped to deal with this weather, is it?
No, absolutely not. I mean, I was just having a look before I came on, and it looks like from these heat waves alone, the UK economy has lost about £4.4 billion due to this summer of heat waves. And you've spoken already about the severe damage to farms and to crops. That's going to have a knock-on effect for human health in the UK because our food prices are going to go up, and that's going to exacerbate the cost of living crisis, and that's going to widen that we start to hear more and more about. That really then puts an additional strain on people's health, but also then on the health service. And, you know, you talk about these houses that burnt down, and that in itself is a tragedy. God forbid there was something like a hospital that burnt down because of a wildfire, or a GP surgery, or even some care homes, for instance. And just think how horrific that would be. What we really need to be clear on is that, some commentators have spoken about treating this as the new normal. Right. We're absolutely clear at Doctors Association UK, this is not the new normal. This is the latest baseline in extreme weather events. Things are only going to get worse unless we take decisive climate action.